Right. Can everybody hear me now? I think I had some microphone problems.
Thank you. Yeah. Vâng, chúng tôi nghe thấy rồi. Vâng, xin cảm ơn Darren.
Ladies and gentlemen, welcome to this webinar on COVID-19 vaccine deployment in Vietnam, the role of the logistics industry. Hosted by the Logistics Industry Reference Council, supported by the Australian Government through Oz for Skills, and organised with the support of VCCI Bureau of Employers, Ho Chi Minh City and Australia Industry Standards Global. We're grateful for the participation of LARC members and stakeholders in this webinar. We welcome your interest in this important and timely issue. COVID-19 sees us living through very challenging times, which we're all very well aware of. Economies are struggling and education systems have been disrupted. There's no higher priority for countries in our region than access to safe and effective COVID-19 vaccines, which will help our economies reopen and will ensure stability. To help advance economic recovery, health security and stability, Australia will provide an estimated $34 million to Vietnam over 2021 to 2024 through the Vaccine Access and Health Security Initiative. We are working with UNICEF, the Vietnamese Ministry of Health, to support the delivery of vaccines in Vietnam, including through cold chain storage upgrades and training for health workers. This will complement our efforts to provide health advice and to support the procurement of COVID-19 vaccines in Vietnam and also within the region. As Vietnam prepares to deliver its national vaccine distribution campaign, it is timely to consider and prepare for the central role that logistics enterprises may need to play in supporting this enormous task. Vaccines will need to move from docks and factories to Vietnam's most remote locations. And when delivering a large-scale vaccination program, it is important that no one is left behind. This webinar provides us all an opportunity to better understand some of the logistical requirements of vaccine distribution and some of the organisational and capacity challenges the sector may need to face to prepare for the vaccine rollout. We will learn from Australia's many experiences in managing a national vaccine distribution program, which will hopefully be highly relevant to Vietnam. Like Vietnam, Australia will distribute a mix of imported and domestically produced COVID vaccines. Delivering these vaccines will require managing complex supply and cold chains with different storage and handling requirements. And both countries face the challenge of ensuring that vaccines reach our most remote communities. This webinar represents an important development in the evolution and growth of the Logistics Industry Reference Council. The LARC has a great opportunity to demonstrate its leadership in building a skilled workforce for the logistics sector. We hope that today's presentation provides an opportunity for the LARC to decide the role that it might play in meeting Vietnam's vaccine delivery skills demands, and to define what might be required to support the LARC if they adopt such a role. This is an extremely important task that will have long-standing benefits to Vietnam's continued socio-economic development. Many thanks to the LARC leadership, VCCI and AIS Global for organising this event, and also thanks to our experts from RMIT. I wish you all a stimulating and fruitful discussion. Thank you.
Thank you very much, Brendan. Great words of wisdom and great words of encouragement there. Look, we're very grateful for the support of the Australian Embassy and Department of Foreign Affairs. You've enabled this webinar to take place. So we're very grateful for the support that you've given. And we're very grateful for the presence of yourself at this webinar today. I think it's a great demonstration of the commitment that Australia has to the cooperation with Vietnam. So we're very grateful for that. I would now like to invite Mr. Vu Ninh, who is the chairman of the Logistics Industry Reference Council and an enormous supporter of the work that we have been undertaking in Vietnam. I'd like to invite Mr. Ning to say a few words in the opening statement for our webinar today. So over to you, Mr. Ning.
Anh Ninh ơi, em xin lỗi, anh bật mic giúp em được không ạ?
Nghe được chưa ạ? Ok, cảm ơn. Xin chào ông Brandon, Bí thư Sự quán Úc tại Việt Nam. Kính chào anh Michael từ chương trình Alpha Skill. Kính chào tất cả các quý vị diễn giả, các thành viên của LIC cũng như là tất cả các anh chị chuyên gia tham gia cái buổi hội thảo ngày hôm nay. Thì như mọi người đã biết, chúng ta đã bước sang năm thứ 2 của đại dịch COVID-19 và nó tác động đến toàn bộ đời sống kinh tế xã hội cũng như cuộc sống của toàn nhân. Từ đầu năm ngoái, LIC đã có một cái báo cáo đánh giá tác động của đại dịch Covid lên ngành logistics, và đây cũng là một cái việc làm đầu tiên của LIC.
Anh đang mute anh ơi. Anh mở microphone của anh lên được không ạ anh Quyết ạ?
Mọi người nghe được không ạ?
Anh Quyết ơi, chắc là anh phải dịch lại cái đoạn mà lúc nãy rồi, vì lúc nãy là mọi người không nghe được ạ. Từ đoạn anh Ninh nói ạ.
Anh Ninh ơi, anh Ninh ơi, em xin lỗi là mic của em bị tắt, cho nên là anh có thể nói lại giúp em được không ạ, để em dịch lại từ đầu cho các bạn quốc tế cùng nghe ạ. Vâng, em xin lỗi.
Ninh nói lại cái là ngay từ đầu năm ngoái khi đại dịch Covid xảy ra thì LIC đã thực hiện một cái báo cáo đánh giá tác động của đại dịch tới ngành.
Assessing the impact of the COVID-19 on the logistics industry, and then we ask a big question to LIC, what we could do next on our end. Well, Mrs. Ning from VCCI and Mrs. Ming of Oxford Skill, I myself and other members thought that the outbreak of COVID-19 also required vaccine, and the import of vaccine and the distribution represent big questions that we need to address. And we really want to have a webinar on this topic, and it's very lucky that we have the support from AIS and Oxford Skills to prepare for this webinar. We prepared for it from last year, and this is an event showing the strong commitment and dedication of the LIC members and also Oxford Skills in response to COVID-19. Well, I think that there are some areas of focus. First of all, COVID-19 vaccine logistics. Well, we know that COVID-19 vaccine is now in the market and distributed to different countries. It's no longer in the laboratory. So it has become a commodity in support of the life of people. It's not in the laboratory anymore. So once it becomes a commodity, it's going to be part of the distribution, production distribution, part of the logistics industry. So the WHO, World Health Organization, issued a guidance on the national vaccination program, focusing on the role of the logistics industry. And it's quite similar to the standards for logistics industry to be part of the COVID-19 vaccination program. Well, it's also similar to what we did when it comes to the APAC logistics occupational skill standards. We adapt them to Vietnam circumstances. So what I mean here is that once COVID-19 vaccine has become a commodity, we need to have regulations, standards in terms of logistics, to make sure that all players, including producers and other stakeholders, can meet when it comes to COVID-19 vaccine. So logistics and COVID-19 vaccine are new, and they are, intertwined. So we need to have specific guidance based on the WHO guidance. I mean, we need to tailor it to Vietnam circumstances. Second, in the webinar today, I think we will learn the experience from Australia, which produces COVID-19 vaccine and also roll out successfully its vaccination program. Quite similar to Australia, Vietnam is now rolling out COVID-19, and I think that COVID-19 vaccine will be used across the country. There will be issues regarding transport from factories to the clinics, to the hospitals, and in Vietnam, we have quite similar geographical conditions in the country here, quite similar to Australia. Our country is quite diverse, and we have remote areas, which is quite challenging for logistics. So we will learn the experience from Australia on how to distribute COVID-19 vaccine to remote areas. We also will learn the experience from AIS, ARC on how logistics enterprises and industry players could be part of this exercise. So I hope that at the webinar today, we will shed light into those topics. And third, at LIRC, we need to think about how we can work with the logistics industry to roll out the national COVID-19 vaccine. In Vietnam, we haven't got any specific event or workshop or seminar on how the logistics industry could be involved in this process. So I think this is a very first event of this type in the rollout of the COVID-19 vaccine. In Vietnam, the question we are asking is who could be bold enough to take the lead role in this process, and luckily LIRC, with the support from VCCI, which is an NGO, but has a very important role in advising the government of Vietnam. LIRC has been supported also by the Australian government, bringing together stakeholders. So I think in the early stage, LIRC organizes the webinar today. It shows our commitment from the logistics industry to the COVID-19 vaccine deployment. LIRC brings together the stakeholders with the engagement of the state management agencies, associations, BCCI, logistic enterprises. So I'm sure that LIRC would be very much relevant, and we have capacity, we have dedication, we also have the support from Australia, from the government of Vietnam, and other agencies. So LIRC should be bold enough to deep dive into this topic of COVID-19 vaccine and logistics, so that what we got today will be the basis for us to organize further events in the series. For example, on how to transport, how to store vaccine, how to distribute, who would act as a focal point, who would do what in the process. And hopefully we can produce a report or an announcement through Oxford Skills or VCCI to share with other relevant authorities in Vietnam to make sure that the outcomes of the webinar today and the other future events will benefit the health sector, in the logistic industry, the health sector needs to transport vaccine. They know who they can rely on or count on. So these are three important points that we want to keep in mind. And finally, we are very grateful to the Australian government, AIS Global, and also their experts for supporting us in making this webinar possible. Actually, we have a long wish list. Many logistics enterprises want to do it, but we don't have enough resources or capacity to bring stakeholders together like this. While this is a webinar, I think this is critical support from you. So I hope that we will continue to have events like this in the future. And again, I'd like to thank you for joining us.
Thank you very much, Mr. Ning. Very grateful for your words of encouragement and the context in which you've set this webinar. I think you're right. This is a great opportunity for the LARC, and I hope out of this webinar we can start to realise what it may need to do to position itself to be a potential focal point for logistics in the national distribution of vaccines. So I want to thank you very much for your very kind words of encouragement for this webinar. I'd like to now start our presentation, if I may, and I will start with some presentation materials. So here we are. Let's start our presentation. First of all, let me introduce AISG for those of you who don't know who we are. We are a skills service organisation based in Australia, and we essentially support skills development. We support the work of the industry reference committees in the Australian context, and AIS is responsible for acting as a secretariat to 11 of the industry reference committees in Australia, including the industry reference committee for transport and logistics. So we are very much in the same space as the LARC. We're going to have a special guest join us today, Professor Victor Gakara, and Victor will talk to us soon about some of the things that we're going to talk through from the Australian experience. We're going to share with you some of the lessons learnt from the vaccine rollout in Australia. We've been underway with our national vaccine rollout program since late February. So we've got several months of experience in managing the national rollout to share with you. But Professor Gakara comes to us from RMIT in Melbourne. He's a professor in the College of Business and Law at RMIT University. He did his PhD in International Political Economy at Cardiff University, and he has a special interest in research around the technological impact of change and workforce skills development, issues that we've been really touching on in some detail in the course of our work in the last couple of years. What we're going to focus on in this webinar is really three things. We want to share with you some of the guiding principles that are developed by the World Health Organization to set standards for the rollout of a national vaccination campaign. Of course, we're talking about a national vaccination program on a scale that is largely unprecedented in history. So we're talking about what will be a fairly unique event, and the WHO have developed some instructional guidelines around that, and we will talk to those guidelines. We want to also talk about how the LARC could position itself to play a central focal point role in a national vaccination campaign. And we want to also develop a statement, if we can, on behalf of the LARC to announce the intentions of the LARC to position itself for this future role. The other thing that we're going to do in terms of objectives is really try and understand what the logistical requirements are for the rollout. It's important to understand all of the considerations and planning needs that need to be put in place for the rollout. We're going to describe the critical role of the logistics sector in a national campaign, and particularly what the leadership role could be of the LARC. We're going to learn from other countries' experiences in this regard. As I say, Australia are some way down the track with our national rollout, but other jurisdictions are also well advanced with national vaccination campaigns. And we're going to look at some of the lessons that have been learnt from those other jurisdictions. And hopefully we can define a pathway to coordinate and lead the logistics sector in the vaccine rollout program. I should also just mention a couple of protocols, I guess, before we get to the outcomes. I'm going to use the chat function to send you some links to documents and audiovisual material. And you'll see some links being posted there, which you can look up. I will, for example, post a link to the World Health Organization guidelines on national vaccine deployment. That document is presently only available in English, but certainly for those of you who are able, it represents the guiding principles for national vaccination deployment. So we hope to be able to use that in the course of this version of our presentation. We also want to encourage you to ask questions at any time. You're quite welcome to raise any questions in the chat function. We'll try and respond to them. And as I say, we've got some materials that we'd like to distribute and share with you, and some interesting clips that you might want to look at some course. We hope this will be a bit of an interactive session. We will be asking you for your input to some of the issues that are raised in this session. So after the presentation of myself and Professor Gakara, we'll move into facilitated discussion around some of the issues that we hope will be raised from our presentation. So let's now move into some of the detail of what we're here to talk about today. And I guess the first thing to point out is, as I've said, the World Health Organization has developed a comprehensive guideline document to guide a national planning around vaccine deployment. This is a comprehensive document. It sets some fundamental principles around how national deployment programs should be organized. Of course, in Vietnam's case, you have essentially commenced your program of vaccination. And as was the case in Australia, the priority populations are receiving the vaccine first. And that is, as in the case of Australia, essential workers, frontline workers, health, quarantine staff have been designated as priority populations. And my understanding is in the Vietnam situation, those priority essential worker categories have started to receive imported Pfizer vaccines. Of course, Vietnam does intend to make its own vaccine, and that will be the vaccine used for mass distribution and mass vaccination. So we have a need under the World Health Organization guidelines to identify an accountable and coordinate a national planning process. And Vietnam has established that process through the National Committee on COVID-19. So we see that structure already in place. A functional cold storage, logistics and vaccine management system needs to be in place. And I suspect that represents really the key challenge for Vietnam at present, particularly in cold chain storage and cold chain supply chains. This will be a significant challenge. and we'll talk a little bit about some of the particular issues pertinent to cold chain management in a few minutes. Clearly, there's a need to support a national vaccine program with appropriate human resources, trained human resources, and this will again be an urgent and necessary task. And there is a role here, of course, for our vocational college partners to play a leadership role in developing the type of skills, training needs that are going to support a national vaccine rollout campaign. If we move on and start to look at some of the particular issues that we're dealing with around logistics, we just need to understand that we are talking about very, very large quantities of goods, millions of doses, hundreds of millions of doses, supporting medical equipment, such as syringes, sterility equipment, and we're also going to be dealing with very large volumes of medical waste. These are all going to be important issues in supply chains. So we need to be ready for dealing with the volume, the security, and the removal and dispersal of these items. So we're talking about a very large scale exercise. We're talking also about complicated supply chains. We're talking about cold chain. We're talking about the likelihood of intermodal and multimodal transport needs. Of course, we're talking about a national distribution. So we're likely to see a variety of modes of distribution used. We're also dealing with an essential element of quality control. Because these vaccines are temperature sensitive, all the vaccines that have been developed to date are temperature sensitive. The vaccine must stay effective through the entire supply chain. And I think this is going to be the #1 challenge for logistics enterprises in the national campaign, is ensuring the security of temperature through the supply chain. I suspect that will be one of the larger challenges that we see logistics enterprises having to face. We're also likely to have to deal with demand volatility. And certainly that's been the case in the Australian experience so far. What I mean by this is we've seen demand surges, we've seen issues around hesitancy to take up vaccination. And these are things that need to be dealt with through good communication and public health messaging very early in a national vaccination program. So we're likely, if the Australian experience is any guide, to see initial demand surges as interest is generated in the vaccine program. People seek to be vaccinated early, and then we may find quite volatile reactions to supply and demand. And it may be quite regionalised as well. So we may see different parts of the country operating differently in terms of demand creation and demand for vaccines. And certainly in the Australian experience, this has been a significant issue of meeting timely supply of vaccines to areas of high demand. Clearly, warehouse storage and logistics become a critical issue in this supply chain because we are going to very likely be dealing with large-scale storage, site-based storage of vaccines and associated equipment, and there will need to be, very well organised inventory management. Wastage is going to be an issue in vaccine management, and we certainly need to be minimising to the greatest degree possible any wastage. So inventory management and dispersal and the electronic recording of that becomes really critical to minimise issues with supply and wastage. I think we're also likely to expect that this is going to be a multi-year process. I think it's becoming evident that we will be dealing with additional requirements for vaccination, booster shots as they're called, to boost the efficacy of the vaccine in populations over multiple years. So this will not be a one-off exercise. It may well become a multi-year exercise. So we need to be ready to adapt to the demands of vaccination programs within the course of normal business, incorporating this opportunity within normal logistics business. We may find that over the coming years, this becomes a regular cycle of activity. So we need to be well aware of that. Underpinning all of this, of course, is the critical importance of effective communications. This is likely to be the largest logistical exercise outside of wartime that we've seen in the history of our countries. So we need to be right on top of the communication systems and mechanisms that will underpin our planning for this process. I'm just showing you here a snap from the World Health Organization guidelines. I apologize that it's in English. Unfortunately, we don't have it in Vietnamese as yet. But what it does highlight is that the focal point for logistics really sits at the national level. It sits in direct relationship to the incident manager position, which essentially coordinates both the logistics and the vaccination element of the program. And it effectively reports in direct line to the National COVID Committee. This is the recommended model from the World Health Organization for an effective national campaign. There may be variations. Certainly in Australia, we have some variations on this. And I suspect in Vietnam's case, you similarly will have variations around this. But it does provide a framework for distribution of vaccines down to the commune level. And this will be clearly one of the challenges for logistics enterprises, is ensuring, as Brendan mentioned in his opening address, the equitable and saturation coverage of vaccines. This is going to be a challenge for the Central Highland provinces, some of the northern, more remote provinces. Distribution will become a challenge in these areas. So we need to be planning and prepared for using innovative and adaptive means to distribute vaccines. It may require, as I said earlier, multimodal types of transportation. We may be looking at last mile challenges, particularly for some remote areas. And how we do that, of course, we're seeing a burgeoning and explosion of e-commerce in the last decade. And we will have many lessons learned from last mile distribution through e-commerce popularity that we can draw upon to learn how we can distribute this vaccine effectively. Of course, many e-commerce products are not subject to the same cold chain requirements that this vaccine is, but we do have some established networks that can support that movement at least. If we now look at some of the issues around planning and management needs, what we see here are the World Health recommendations for planning. In fact, we might have moved on to resource management, I think. So we're now looking at human resource management. So what's critical here is essentially the identification of human resource needs. And we're talking about, very specific skill sets that we're going to need to see infused into supply chain management. Really important that we are clear around the types of human resource skills needs that we need to see developed in very short order to support a national rollout. So when we think about immediate human resource needs, we're thinking that this may need to include certainly data management and forecasting skills. The planning process will rely upon good data being generated and shared, and the ability to forecast needs. We're talking about scheduling and movement coordination. This, of course, is a standard of logistics enterprises management, but we're talking about scheduling and movement coordination on a scale that we've never seen before. So the scale of this now becomes the main challenge. We're also talking about cold chain handling, and this is likely to become, you know, a hot topic of demand, and vocational colleges really need to be prepared to rapidly respond to these types of skills needs. Cold chain is a relatively new concept in Vietnamese logistics. It has application, of course, much wider than just health programs. Certainly in agriculture, cold chains are becoming critically important for quality of produce protection and distribution of goods. So we can see that there's particular skills and knowledge that is needed to manage cold chain processes. The World Health Organization has actually produced some very useful materials around tools that can be used to identify gaps in supply chains and identify needs for cold chains. And I will post links to some of these diagnostic tools which the World Health Organization has produced in our chat room function. And I will encourage you to look at some of these diagnostics and planning tools that the World Health Organization has developed, which can assist you in developing your systems for supporting the rollout. I have also included on this slide a YouTube audiovisual clip. I will post the link to that audiovisual clip. It's actually quite interesting. It's based from the United States, and it talks about some of the practical challenges that logistics firms have encountered in the vaccine rollout in the United States. And I think for those of you who are at the forefront of logistics in this country, in Vietnam, I think there'll be a lot of interest in listening to practitioners, your contemporaries in the US context, talk about the challenges that they've faced so far. So I'll post those linkages in the chat room soon. What's also really important, and I think particularly for this exercise, is the preparation of the cold chain and supply chains in general. We know that most vaccines that are to be used for COVID vaccination need to be stored somewhere between -2 or 2 degrees Celsius and 8 degrees Celsius. But there are, of course, particular vaccines that require ultra cold chain equipment. And that is, you know, in the order of -70 degrees. You know, this is very specialized equipment that is needed to support this. And it may well be the case that this equipment will need to be manufactured or imported to supplement the volumes that are available presently within current cold chain supply chains. But essentially, we're talking about you know, the use of frozen phase change material, dry ice, in lieu of traditional cold packs during transport. We're talking about innovative approaches that may be required to support temperature control. One thing that's going to be needed is to identify and address any gaps. Again, some of these diagnostic tools that the World Health Organization have developed can be very useful in this respect to identify any gaps and needs in terms of storage, in terms of distribution, in terms of the critical role of temperature monitoring and tracking, and reporting as well of vaccine stocks. Again, we're dealing with a product which we need to really be very careful with in terms of its quality control, and we really want to try and avoid as much as possible any wastage of this very valuable product. So getting adequately trained staff to support the national campaign is going to be a critical need. It's going to need to be undertaken rapidly, and it's going to need some very, I guess, innovative approaches to knowledge and skills development from some of the vocational colleges that are partners in the LARC. And we'll talk a little bit more about what those needs might look like when we have Professor Gakara present on his topic very soon. Finally, I just want to talk specifically about supply chain functionality. There's clearly a need for very clear guidelines and standard operating procedures that are based on the vaccine profiles. So we're really needing to tailor our operating procedures to the profile of the vaccine, depending on what type is used and what their storage requirements are. And there is quite a variety of storage requirements between the current vaccines that are used. Pfizer, AstraZeneca, both have different temperature control requirements. So we need to have standard operating procedures in place that are based on the vaccine profile that's being used. We need to be able to disseminate these vaccines through multiple channels. And we need to also be able to disseminate these procedures through various platforms. And of course, most efficiently through mobile communications and electronic means, because of course we're dealing with a process which is going to unfold and roll out on a very large scale very quickly. So we need the most efficient means of information distribution possible, and we encourage, as we've done in Australia, the use of mobile technologies to enable that point-to-point communication. Our warehouse infrastructure is potentially going to need to be redesigned. There may well be requirements, specific requirements to ensure safe and smooth handling. So issues around receiving, issues around packaging, storage and transportation, monitoring of vaccines, security of vaccines. These are all issues that may require different approaches to warehouse configuration than is currently operating. The cold chain inventory will need to be updated. Storage and transport capacity will need to be assessed for its adequacy. Equipment functionality will need to be tested. And we need to have a systemic temperature monitoring control process in place. This will be a process that will require systemic temperature monitoring from point of entry to point of dispersal. This will be a very large obligation on enterprises to maintain quality control over the temperature of vaccines. This, again, will be the greatest challenge that I suspect logistics enterprises are likely to face. Of course, complementing that is the need for security of power supply to maintain cold storage chains. So, you know, we're talking about backup generators. We're talking about having alternative sources of electrical supply, because we can't afford failure in any supply chain with vaccines. I mean, we've seen in Australia already some spoilage through inability to maintain temperature control. We're not really able to tolerate high levels of spoilage with a vaccine as needed and as sensitive as the ones that we're dealing with here in Australia. So far in Australia, it's been Pfizer and AstraZeneca as the primary vaccines, but Australia has announced today the agreement to purchase vaccines from Moderna. So we're now looking at potentially 3 different forms of vaccine being used in the Australian context. And certainly in Vietnam, you have started using the Pfizer vaccine for high priority populations, but you will also be making a domestic vaccine, which again is likely to have, you know, specific needs in terms of cold chain storage. So let me conclude my initial presentation at this point. This has given you a snapshot of the World Health Organization recommendations around planning for a national vaccination program and some of the logistical challenges that are likely to emerge. What I'd like to do now is hand over to my special guest for today, Professor Victor Gakara, expert in logistics from RMIT University. And Professor Gakara is going to share with you some of these experiences, from the Australian experience to date, some lessons, I guess, from the Australian experience to date. So I will hand over now to Professor Gakara and welcome him to our webinar.
Thank you. Thank you very much, Darren, for that introduction. And thank you for inviting me to share my views and my observations of the Australian context, and also my general understanding of the complexities of this program, as you have very, very extensively outlined. And I agree with you absolutely entirely on the complexity, the scale, and the challenges that are involved. So as you've been told, my name is Victor Gakara, and in addition to what Darren said about me, I also had a specialized research group within RMIT, which is focused on global transport and logistics. So that is the Global Transport and Logistics Research Group. And over the past few months, indeed, over the past 1 year, me and my team have been doing a lot of work around trying to understand this area and the challenges, the logistics challenges that are involved in the massive rollout. And I'm happy to, at a later stage, maybe share some of the papers that my colleagues have written that try to model the challenges and the challenges of the logistics involved. Thanks, Darren. So what I'm going to do today is really to look at what has happened in Australia, the specific challenges and the unique challenges that face the Australian context, that define the Australian context, and try to derive from those observations and see how Vietnam might also approach the same, and what kind of lessons might be learned. So Darren has very aptly described the complexity of the program, and I emphasize that in any country and in any environment, this is perhaps the largest and most complex logistical task outside of say the Second World War and First World War. So that comes with its own challenges. But the question, I think, for us is to think about what is the breadth of the challenge? What is the nature of the challenge? What is the structure of that particular challenge, in order to design effective approaches to addressing it. So this is how I look at it from a very broad perspective. And I have my own view on how my view on logistics and the complexities of logistics. But the way I'd like to look at this in this particular context is to look at 3 levels of challenges. And the first one is the supply chain challenge. That is the supply chain challenges that address or that speak to the production and distribution of the vaccines and the supply chain functionalities that are involved in that. So it's mainly the production and the delivery of the vaccines at a very high level. That involves the manufacture of the vaccine. It involves the resources that go into the manufacture of the vaccines. But it also speaks to the challenges of the supply chain in that context. And I'm going to speak a bit more about this in a bit. The second broad category of challenges is the transport and distribution challenge. And I think this is where we tend to focus our attention on, and to the detriment of the other broad challenges. I think that is something that we have to rethink as we tackle what Darren very clearly described as likely to be a very long rollout task into the next few years. So that is the transportation distribution. We talk about the actual movement, the vehicles that are involved. We talk about warehousing, and we talk about the handling of it. So the traditional focus of logistics. Finally, and I think this is probably the most critical in this sense, is what Darren referred to as the last mile. And this is the most delicate in my view, because we've got very highly fragile product. We've got very unpredictable circumstances of distribution. We've got messaging coming from all over the place. How do we coordinate the last mile, the actual distribution and administration of the vaccine? So it's not just about the movement of the vaccine from manufacture to hub to final delivery and administration. It's also, importantly, the movement of the people and the facilitation of their movement to where the vaccine is going to be delivered. We've got to look at those two angles. So the large-scale movement of the vaccine itself, the product itself, and the facilitation of the logistics of the people themselves moving to various administration centers. And Australia has faced initially what we might call the teething problems, and I think we are still facing the same. We are tackling through them, but these have influenced the ways in which the rollout has panned out, the rate at which it has been rolled out, and the effectiveness of the initial distribution. Next slide, please, Darren. All right, so this is my my broad view of logistics. And I think logistics is everything. I mean, human life is defined and organized by movement. I'm receiving an echo. Yes, okay, it's disappeared. So you can either choose to look at logistics from a narrow perspective of transport, warehousing, and parcel and mail and all that. But actually, logistics is a lot more than this. And I think in this particular case, the Australian case and many other contexts are shown us that if we focus on this narrow definition of logistics and concentrate our solutions to these broad questions, we are likely to miss the nitty-gritty and the much more detailed and nuanced challenges that we are likely to face. And I'll talk about this in a bit. So how do we avoid the chaos that is likely to arise from ignoring or failing to focus on the particularities of the distribution, the specificities of the different locations, and the demand fluctuations that Darren talked about earlier on, the fragility of the product that we are talking about, the questions about, the specific questions about this, even as minor as the scheduling and who is going to administer this, and how do you get people to go to the administration center? So I think taking a broad approach also accommodates the question of, do we have the right skills? And I think this is where the organization, the LISC comes into its importance. Often, and I said this in one of media interview that I gave much earlier on in the rollout. I said one of the areas that we tend to forget in this all complex situation is the skills. We talk about moving the products from one place to another, storing it, and then administering it. But we forget about the specific skills, the unique skills that are required to ensure the movement of this product, but in a way that maintains the efficacy of the vaccine. I think that is important. So temperature control, like Darren said, how do you manage the entire process? How do you structure the entire process? And that takes a lot of skills. And we've seen a few instances of failures that are related to training and skills in Australia in its first initial stages. Next slide, please, Darren. So Australia, let's look at Australia's unique logistical situation. Now, Australia clearly and very uniquely defines, illustrates the statement of a tyranny of distance and elements in every sense. So Australia is farthest, as you know already. Australia is remote in its global location. So we have to talk about the movement of the vaccine from overseas, Germany and the rest of them, all the way to Australia, which is a far distant land. That is the first illustration of the tyranny of distance. But within Australia itself, Australia is a large island with highly remote locations and a sparsely populated, sparsely located population. So that presents its own challenges in terms of how do you reach every part of the country, which is sparsely populated and faces a wide variety of wild elements. So we've got extreme temperatures. We face prolonged seasons of drought. We face prolonged seasons of wild weather variations, from floods to fires and all this. So Australia has got all these, a combination of factors that create logistical nightmares. And I think over the many years, Australia has developed a certain resilience, a certain capability in its logistics sector, which means that we are able to respond to some of this much more effectively. But then, of course, we are talking about a very unique situation. Darren, let me know if I'm running late at any point. I'm happy to adjust my presentation. All right, so we've got a situation where we are confronted with a combination of distance, location, geographical, and weather situations that create a big logistical challenges. So how has this impacted upon the distribution of the vaccine in these initial stages? Next slide, please. Thanks, Aaron. So looking at the broad preparedness of Australia. Now, I talked about many years of experience in this kind of conditions have led Australia to have a strong national emergency response framework that is flexible enough and comprehensive enough to respond to many situations. So be it wildfires, be it any form of emergency, be it floods, be it a situation like the one we are dealing with now. So that is the framework that is in existence generally that the COVID response has drawn upon. So the framework is, as I've said, is scalable, is flexible enough and scalable to the different locations and different jurisdictions, i.e. the states and territories. So the health emergency response plan for COVID-19 has directly been derived from that. So there is a precedence and there's a context within which an efficient response program has been derived. So you've got the National Response Emergency Response Framework. Then you've got the Health Emergency Response Plan for COVID-19, and then you've got the COVID-19 vaccine rollout. And I think this is, and Darren alluded to this, I think having that level of framework, national level framework, is very helpful in being able to drive a national response to what is obviously a large-scale national crisis. Next slide, please. Now, this is just very briefly to show you what the rollout plan for Australia was, and then I'll use this as a basis to see how effective it has been so far. So the first two phases, as Darren alluded to earlier on, were targeting what we call the emergency and first responders group, and also the vulnerable group. So you've got frontline workers, health workers in hospitals and aged care facilities. And then you've got the elderly, the Aboriginal and Torres Island adults, adults in medical care and etc., etc. So it's the vulnerable groups and the emergency response workers. Then phase 2 was mainly for the rest of us, but starting with age groups and cascading down to phase 3 when you've got the under 16s. Now, we are going to later on see how far we've gone with this, but as you can see, the intention was, or the plan was, that by the time phase 2 comes to an end, we'd have administered a total of 16.2, around about 16.2 million doses. Now, the question is, to what extent have we actually achieved that, or to what extent are we on track to achieving that? And I can say that we are quite far off the mark, and we're going to see what are some of the challenges that have led to that. Next slide, please, Darren. All right, very quickly. So Darren again alluded to this. These are the vaccine contracts that Australia has established. Initially, for the vulnerable and frontline workers, it's the Pfizer vaccine that is being rolled out. So you can see there was a contract for 10 million doses. Then the AstraZeneca for 58.3 million doses. Where we have reached now in the rollout, there's a combination. So we are rolling out the Pfizer vaccine at the same time we are rolling out the AstraZeneca. So those are the main two vaccines that we are rolling out. But there's a third one that has been announced that is coming in the next few months. So we're going to have three vaccines being delivered at the same time. Next slide, please, Darren. Okay, now let's get to the nitty-gritty of the concerns or the challenges and the lessons that we can learn from the Australian context. Now, the key concerns for Australia, when we were thinking about how the vaccine rollout was going to be managed and to be delivered, there were a number of key concerns. And what I've done is to try and structure them or look at them in those three categories that I talked about. So you've got the supply chain aspect, you've got the distribution aspect, and you've got the administration aspect. Under the supply chain aspect, I think, that was dealt with fairly easily. And the choice of vaccine, not that there was much variety, but the choice of vaccine. So the contracts were signed. There was a question of, do we make them locally? Do we import them? And I think, just like I've learned now from in the Vietnam case, we decided we're going to import the Pfizer vaccine. The AstraZeneca is developed predominantly within Australia, which makes it much easier. So the main concern, in my view, were in the distribution and the administration. So the questions that we were asking ourselves at that point is, how do we ensure a secure end-to-end cold chain? For a country that faces the kind of weather and distance challenges that I alluded to earlier on, end-to-end cold chain was the key concern. How do you ensure that you are able to transport the Pfizer vaccine, which requires up to -70 degrees, from, say, a place like Melbourne or Sydney or Adelaide, for that matter, or Brisbane, to the center of Australia? where you have wild temperatures, right? So how do you maintain the efficacy of the vaccine in those varying conditions? How do you provide the necessary sterile environment during all phases of distribution? And I think a key question here is not just about the infrastructure and the superstructure, but also the skills. At the point of talking about maintaining the sterile environment, you require specific skills and specific awareness of the people that are running the program. The third question is, how do you maintain the delicate handling of the vaccine during transportation in light of how fragile it is? And it's not just, I think Darren again captured this very well. It's not just the product, the vaccine itself. It's all the other equipment that are involved in the process of the delivery and the transportation of it, the storage of it, the monitoring of the temperature, to make sure that, because I mean, what we have to realize, and I don't have the deep clinical understanding of this, but any slight misadjustment of the temperature, it doesn't have to be too big, but any slight fraction is likely to affect the efficacy of the vaccine. So what kind of skills, what kind of infrastructure, what kind of superstructure is going to maintain the integrity of the program? Under the administration aspect, which I think is also very challenging, and unfortunately, even for those of us who are closely studying this from the beginning, we actually failed to pay attention to this. The questions under this include, how do you reach the target groups, the various target groups? I think we talked about this significantly. In Australia, again, as I said, it's sparsely populated. You've got very remote rural communities that need to be reached. And even more challenging is that some of these groups that we are talking about being remote and remotely located are included in the categories we refer to as the vulnerable. So it was urgent that they be reached right at the beginning. A second question is, how do you facilitate efficient and convenient endpoint administration? How do you make sure that everyone gets the 2 doses within the required time? Now this, the 2 doses are actually quite problematic, because I would, jokingly say, you scratch when it itches, right? So you can give me the first dose, and unless, for some people, we tend to be complacent because I'm not sick, I'm not feeling ill, I'm not in pain. What is the motivation for me to actually pursue the second dose? There has to be that motivation. How do you keep messaging? And Darren talked about the utilization of mobile technologies, mobile communication technologies, SMS messages and telephones and all that. There has to be a massive movement that is sending out, pushing out these messages to make sure that people, having got the first dose, will then follow up to get the second dose. Who should administer the vaccines? That was a big question for Australia. Should we have GPs administer the vaccines? Do they have the capacity to do this? Most of the GPs, for those of you who might know the Australian context, are actually very small operations, all right? Accommodating maybe at most 50 people at any particular time. Do they have the facilities? Do they have the capacities? Or should we roll out mass vaccination centers? These are questions that we needed to ask ourselves. In the United States, they very earlier on decided that these were going to be rolled out as in mass vaccination centers, including shopping malls and other places like that, other public places like that. I think that was the right thing to do. Australia caught on much later on when the idea of hub vaccination centers came up, was introduced just a few weeks ago, actually, about a month ago. So, who should administer the vaccines? How to ensure they receive the right amounts of vaccines? We had situations where GPs have got vaccines, but there are no people coming in. We had situations where people are coming into GP centers, but there are no vaccines. All right. So there was always this. Still there's been this issue of how do you align supply and demand in relation to the question of who is administering the doses. And finally, how to combat misinformation. And I think this is crucial and critical. The messaging. There have been misinformation, there have been anti-vaccine messaging and conspiracy theorists and all that, and people get caught up in all this. I was talking to a friend of mine yesterday, actually a student of mine, and she said that she doesn't see the urgency for her to get the vaccine because she's healthy and young. I thought, oh, okay. So if you have enough people with that kind of attitude, then it depends on how powerful the messaging is to tell this young lady that actually, yes, you are strong and young, but you do need the vaccine because this is very unprecedented. It is unpredictable. There are uncertainties. It doesn't depend on just one variable or just a couple of variables. So the messaging, how do you push out the right messaging? So this is how I see the concerns that Australia was facing with in planning to roll out. Next slide, please, Darren. Thank you. So what have been the key weaknesses? And I think I've touched on a few of those. How am I doing for time, Darren? Okay, thank you. So what have been the key weaknesses so far? In my view, the main problem for Australia, what we might consider during the teething period, were twofold. One, it was the global supply chain for the vaccine. And I think this is where a country like Vietnam that is now beginning to put this rollout in place, to have some level of certainty about the global supply. So you're getting the Pfizer vaccine. To be able to say with certainty that we are going to receive this amount of vaccine and therefore we can base our planning on that supply is very important. What we noticed is that whereas we expected certain amounts of doses, we never received those amounts of doses. And that obviously puts the entire program into disarray. So, and the global supply chain issues were related to, there were complaints from Pfizer, AstraZeneca about the failures in the global supply chain for the resources and the ingredients and all that goes into the production of the vaccine. So it was in an area where we as Australia did not have much control over, right? But I think forward thinking is likely to assuage some of those concerns. So for example, if Vietnam is planning to manufacture internally a vaccine, that is probably a good way to go because then you have a level of control. Australia is producing the AstraZeneca that gives a high level of certainty. And I think it means that the program that has been structured can progress as planned. The second part of the greatest concern, I think, and where we had a lot of weaknesses is in the last part, the final distribution, the administration aspect. As I said earlier on, there were issues about the supply and demand and the decisions around who was going to actually administer these doses. We had situations where GPs, a large number of GPs came out and said, no, we don't want to be involved in this because they were considering the liability issues. What if I deliver the vaccine and there are detriment to the recipients? What are the protections that I have as a GP, right? And some considered this to be not as cost effective as they would you know, in terms of considering the resources they have, the capacity they have, and the effort that was required. Now, what that tells me as an analyst standing aside and looking is that there was inadequate communication between the central planning of the rollout and those who were designated to roll out the vaccine in the first place. Was the government and the central command talking to those designated to roll it out effectively? And I think there was a miscommunication there that needed to be sorted out. The second point was misinformation and hesitation. So we had earlier on, we had demonstrations and protests by anti-vaccination groups. And now you might look at those and think this is a small group of disgruntled and misinformed people. But if you have more and more of those protests, what it does is it creates almost like a ripple effect. It creates questions in people's minds. People suddenly start to think, actually, do they have a point? And the more they think about whether they have a point or not, the longer the delays in them going to the vaccination centers to get the vaccine. So it delays the entire process. And I think those are the fluctuations in demand that Darren was talking about earlier on. So how do we combat the misinformation, the conspiracy theories, the anti-vaccination messaging that is coming out? So I think we had an issue in the managing of those messaging. One particular concern that I noted, and I think it's a way that we manage the messaging, and we continue to manage the messaging, is the observations that those who took of a certain age who took the AstraZeneca had the problem with blood clotting. Now, I'm not a doctor, I'm not a medical expert, but I think those who are responsible for the process have not come out very clearly and explained what I think is what is going on. Obviously, I'm a layperson, but this is what I think is going on. That it's not, obviously, it's not everybody who is likely to face these side effects. The side effects come because there is a combination of certain factors, underlying conditions, etc., etc. I think if this message is packaged accurately and effectively and pushed out, people will begin to understand that it's a risk worth taking, right? Not massive number of people are dying. In Australia, I don't think we have experienced any deaths coming from those, from the blood clots. So how has the government managed this messaging? I think has left a lot to be desired. I think that's part of the weakness. I've talked about the poor management of the, and maybe poor might be too harsh, but you know, maybe you know, the distribution, the end distribution, the scheduling could have been managed better. In the initial stages, we had situations where the system for booking the vaccination appointments completely broke down. Right, and that also causes the delays that we are facing at the moment. So again, we come to the question of the skills. Evidence of lack of training and skills in the clinical handling and administration is important. I think, you know, we might be talking of a driver who is driving a refrigerated truck from Melbourne to Wangaratta or some other remote area, from Perth to Kimberley. Now, the driver is a good driver, but have they been trained, at least given the essential skills of managing the temperatures and maintaining the correct temperatures on their truck to maintain the efficacy of the vaccine? So training becomes very important. One illustration of this was a case that was widely publicized where a GP administered up to, what was that, Darren, if you can remind me, up to, I think, 8 doses. And that was obviously, it was not fatal, but it illustrates how easy it is. I don't think that the GP was not experienced. Whatever was going on at the particular time, maybe there was a mix-up, but there were lacking skills at some point. And I think this is important. So these are some of the areas where we've noticed weaknesses. I would describe them as weaknesses in the teething stage. And I think for Vietnam, that teething stage is important, because my understanding is that now is when you're getting the rollout the rollout starting. This is the point where we need to think about what are likely to be the problems during that stage of the rollout. Next slide, please, Darren. Okay, now, so what have been the impact? How have these problems and challenges and happenings shaped the way the rollout has happened? As you can see from that slide, up to the beginning of May, we had only managed to administer 2.5 million doses. Now, considering that in the first phase, we intend to have rolled out 16.2 million. I wouldn't say that we are on track to meeting that in the first phase. So all those challenges, all those problems have combined to create a situation where the rollout has been very slow and punctuated by what you might call chaotic episodes, which have created the issue. So basically that's what, and you can see the rollout across the different states. Next slide, please, Darren. Okay, so I'm heading towards the end of my presentation, and I hope that we can have a discussion about this, hope to generate some views and discussion. Now, the questions for Vietnam, obviously Vietnam does not face the same distance and weather challenges that Australia faces. But nevertheless, some of the key and critical challenges that Vietnam might need to seriously think about are the logistics and transport infrastructure to what Darren referred to as the remote locations. Okay. Now, people in the remote locations tend to be the most vulnerable. And therefore, they need to be the ones that we want to reach as a matter of urgency. People in the remote locations are the ones that are likely to be influenced by misinformation. So therefore, they're the ones that we need to reach as a matter of urgency and make sure that this is it's effective. So adequate and timely supply, I think we've talked about from a supply perspective. Accessibility and logistical connectivity, so the infrastructure to the locations. Cold transportation capacity, that is very important, and we've talked about the cold chain. Now, I was digging around to try and understand the cold chain capacity in Vietnam, and what my understanding is that the cold chain capacity in Vietnam has been growing steadily, but there is only one characteristic that needs to be managed. My understanding is that most of the cold chain trucks and storage, transportation and storage, is really managed by small individual, small scale, owner operator kind of operations. So the question is, how do we consolidate all this into one operation that is likely to meet the large scale need that we need for this rollout? That goes also with the cold storage capacity. And of course, I've talked about the vaccination administration points and managing the anti-vaccination sentiments. But I think the key challenges that we need to think about relates to the transportation and storage and handling but also the scheduling aspect of it. So a broad view of the logistics of the task that we are facing. Cold chain is absolutely essential. I think there is capacity, but that capacity needs to be managed in a consolidated manner. So that involves working very closely with the independent operators of cold chain, cold transportation trucks and storage. So, so in a sense, these are the key questions that Vietnam needs to ask itself at this particular point, and also importantly, which is a concern where the LISC can help and can contribute quite significantly, is the management of the skills and the training that goes into this. Now, one might say, as somebody told me some time back, that it's too late to start talking about training at this point because we are already rolling this out. But as Darren pointed out, this is going to be many years program. So the more we train, the more we prepare people with the skills that are required, the more it's going to get, the better it's going to get as we go along. Next slide, please, Darren. Okay, so what are the lessons? The lessons for me is, considering the specific conditions in Vietnam, I think it's a choice of the vaccine, and I think Pfizer is probably the most challenging of the many vaccines that are out there because of the kind of cold temperatures that it requires, up to -70. But that's a decision that has already been made. So Pfizer is the one that is being rolled out, and that influences all the other decisions that I made around that. Advanced distribution planning. This is not something that we can make decisions as we go along. There needs to be comprehensive and systematic advanced distribution planning. The logistics of distribution, the logistics of administration. Loosely, I use this to mean the distribution is the movement of the product, the storage, the transportation, and the logistics of administration is the logistics of facilitating the people to move to these distribution centers, to schedule for their doses, the first dose, the second dose, and the logistics of disseminating the information constantly and continuously. The logistics probably relying on mobile phone messaging and key figures within the community to encourage people to go and get these vaccines, I think is important, as we have seen in the Australian situation. Training for distribution staff, that is very important. Appropriate handling to maintain the integrity during transportation and distribution. To ensure appropriate handling of the vaccine during administration as well, and to ensure proper administration. So the clinical application. Finally, it's the managing of the information. It is managing information to ensure that the misinformation does not drown out the sensible decisions that people are likely to make without those that level of misinformation. So I think that is very important. So information on the one hand is to make sure that people actually proactively seek the doses and the vaccination, the first and the second, but also the managing the misinformation about the detriments, the anti-vaccine type of misinformation. And I think, Darren, I will stop there and hope that we can have a conversation, and I'm happy to respond to any questions during the Q&A session. Thank you very much for your time.
Thank you very much, Professor Gakara. Very grateful for your input to our presentation. I think you gave an excellent presentation. I think you've raised a lot of very interesting questions. So what I'd like to suggest we do now, we've gone a little bit over time from our original schedule, but what I'd like to suggest we do is we take a short break for 10 minutes. That will allow me to post a number of the links that I have referred to in my presentation around the guidelines manual and some of the diagnostic tools that are being used, that can be used to do gap analysis and make assessments of cold chain requirements. I'll post those links into our chat function. We'll come back in 10 minutes time. So can I ask if we can reconvene at 10:40? And we will then open up for some questions at any points that people may wish to make on Professor Gakara's presentation. And then we'll move into considering how the LARC may be able to position itself to take on a leadership role in a national management of logistics for a vaccine distribution program. So if people are happy with that, can I suggest that we break for 10 minutes and come back at 10:40, and we'll resume our discussion then. I look forward to seeing you then.
Mọi người ơi, trong lúc nghỉ giải lao thì chị Hương BCCI có gửi cái form để mọi người điền thông tin, để bọn em lưu lại thông tin của mọi người và cũng như là để đặt câu hỏi và bọn em lưu lại và sẽ gửi cho ban tổ chức ạ. Mọi người có thể dùng cái form này để điền ạ.
Có mục chat à? Ở đây giờ nhìn thấy rồi.
Mục chat ạ.
Okay, everyone, if we may be able to resume the second part of our presentation today. What I'd like to do now, we have a little bit over 1 hour left of the time we've allocated for this, and I'd like to suggest we tried to achieve two things in that remaining time. First of all, I'd like to invite any comments, any questions, anything that people would like to say in relation to any of the points raised in the presentation so far, and particularly the presentation that we heard from Professor Gakara. If anyone has any questions in relation to the points that Professor Gakara has outlined, any questions relating to the Australian experience with the rollout of the vaccine program, we'd welcome those questions being raised now. So if you do have any questions, please feel free to use the icon to raise your hand, and we'll invite you to ask those questions. So I open the forum up now for anyone to make any comments or raise any questions. I see we have Mr. Viet from Tudor College with his hand up. So Mr. Viet, good to see you, and I'll let you ask your question.
Well, thank you very much, Darren. Well, a very good morning to all of you. Good morning, experts. I'm very happy to be here to attend a very timely webinar. I'd like to thank Professor Shikara for sharing with us the experience from Australia in your country and also in other countries in the world. I also like to thank you for sharing the lessons learned with Vietnam when it comes to importing, storing, and transporting COVID-19 vaccines. So I have a question for you. Logistics workers, what kind of skills do logistics workers need to have in order for them to be involved in the safe distribution and delivery of COVID-19 vaccine in Vietnam, especially when we import large volume of COVID-19 vaccine? We really need to have well-trained workforce. So what kind of skills they need to have in order to meet this requirement? Thank you.
Professor Gakara, can I ask you to maybe respond to that question?
Yes, I'm happy to. If somebody can interpret it for me, please.
Yes, the question is relating to the skill sets that are needed for logistics workers in light of the demands of the vaccine distribution. So what sorts of skill sets and training may be required by people in the logistics sector to support this activity of national rollout?
I think, look, I would expect that the logistics sector in Vietnam has got already well-trained, highly qualified workforce in the primary skills of logistics and transportation. However, what we are talking about here is more than just the skills of a transport and logistics workforce. We are talking about skills that are knowledge and understanding of, one, the delicate nature of the cargo they are handling, two, the operations that go with that delicate nature that are going to ensure that the product is maintained in a sound state until it reaches the end. So it's going to be an additive additional skills in addition to what they already have. So it will be skills related to the temperature control, for example, skills related to in the warehouse, sorting and labeling. It's going to be general awareness of the circumstances that they need to be delivered in. But I think sometimes we use skills far too loosely. I think even just talking about general awareness is important in itself. All right. So we and I think where the LISC comes, can play a really significant role is to probably start rolling out short courses that create awareness, short courses that prevent people the opportunity to develop greater understanding of what is required. So I don't think it's not a second or specific set of skills, but it's an addition to what they already have, which goes along with the awareness of the delicate nature of the product they're handling.
Thank you very much, Professor Gakara. I see Mr. Ning, you have your hand up. You have a question to ask. Victor, just switch on to the English channel and you'll get the translated version.
I'm sorry, how do I do that?
Bài trình bày của
We'll see down the bottom.
Yeah.
Yep, go ahead.
Professor Jekra, can you see the language icon? You just choose the English? Okay. But
trong bài trình bày của
well, in your presentation by Professor Jekra and also Darren talks about technical aspects. I mean, storage, transport, and also cold storage. Well, as you know, LISC brings together large logistics enterprises in Vietnam, including Gemadep, Transimake, and they are big players in Vietnam. They have cold chain in Vietnam. So I invite Mr. Seng Hoàng Thanh, an engineer, cold chain engineer, managing the cold chain at Gemadep. I really want to hear from him. Could you please respond to the question raised by Professor Jekra about the cold chain in Vietnam, the capacity, any gaps in terms of capacity, and also existing situation of storage, cold storage, so that we can learn more from the Australian experience. So over to you, Mr. Thanh. Yes. I'd like to introduce myself. I'm Vương Hoàng Thanh, Director of the cold chain supplier at Gemadep. And today, I would like to present in my capacity, first of all, as a cold chain engineer for Gemadep. I have 20 years of experience, and also in my capacity as a representative of a US company producing a container. That's a company that produces the equipment which is widely used in the cold chain for purposes of transporting and storing and distributing vaccines in the world. I just would like to talk about the technical aspect in the vaccine cold chain logistics, and also the personal experience that I got in this field as a practitioner that has 20 years of experience. Can you hear me?
Về cái khía cạnh thứ nhất.
Well, first of all, well, two speakers earlier today have already talked about the right issues that we need to address in terms of cold chain for COVID-19 vaccine. The first speaker, Darren, emphasized the most complexity, the most complicated thing here is to ensure the temperature from point A to point B, and service providers or suppliers have to deal with complicated issues in maintaining the temperature, unprecedented exercise so far. So this is a surmountable challenge, and Professor Victor Shekara talked about the fact that we not only need to have infrastructure, super infrastructure, but also the skill sets of the workforce that need to be trained and provided to make sure that they are professional and do the right thing in this complicated process.
Cũng nói đến cái last mile delivery tại Việt Nam.
Now, let's talk about the last mile delivery in Vietnam. If we compare Vietnam against Australia, then we can see that Vietnam is very unique in the sense that we have the long coastline stretching from north to south. So we need to have to find optimized solution to ensure the cold chain. So technically, as a representative of a container producer from the US, I can say based on the documents that I have, the booking is the only firm that meets the standards and certification in terms of transport, storing, and delivery of vaccine. The booking has 2 types of equipment for cold chain for different types of vaccine. They have Magnum +5 container with the temperature is -40 degrees Celsius to -30 degrees Celsius. It's very economical for vaccine that require the temperature -20, for example, AstraZeneca. For Pfizer vaccine, which requires the temperature of -70 degrees Celsius, the booking has a special equipment. It is super freezer with a temperature range from -70. In fact, they can ensure the temperature of -65, and they can ensure the quality of vaccine, and they have super freezer that meets the requirement to keep vaccine at the temperature of -70. So in terms of equipment, I can say that the booking has already addressed this problem, but the next question is how can we do it, how we can apply it to Vietnam to maximize the functions and optimal features of this equipment in Vietnam. Well, it's true, as Professor Shekara has already said, it's very relevant to Vietnam. That is, this is for the first time that we have to do this exercise. And second, the coal transport in Vietnam is very fragmented because we have thousands of coal trucks operated by many small enterprises. They're very fragmented, while we need to have consolidated approach, coordinated approach in terms of storage and distribution and transport. So what is the solution that we should take? We cannot hire one private firm to transport vaccine from point A to point B because it involves a wide range of equipment as I described. It involves continuous power supply throughout the transport, and also the delivery process. Private firms in Vietnam may not meet this requirement because of their fragmented nature, and they don't have SOP, standard operating procedures, in place. So from practical point of view in Vietnam, personally, I can say that, well, as a representative of the container producer from the US in Vietnam, I don't think that there's any problem with the equipment, because Jemadef has already made use of this super freezer, and on a daily basis, we operated this equipment. And they also provide equipment that maintain the temperature at -70 to ensure the quality of tuna. So we have experience. I also acquired the experience from other countries in using the equipment. And in Vietnam, while we have the equipment, while we have the experience from using the equipment, but the question is how best we can apply or use it in Vietnam to ensure the cold chain for vaccine in Vietnam that is most relevant and practical to Vietnam. So that's all I would like to say for now in terms of cold chain storage and supply chain for vaccine in Vietnam. Thank you.
Yeah, thank you very much. Some very good points. I think some excellent points raised there. Look, I think as Professor Gakara highlighted, and as you've highlighted again, the fragmented nature of the sector in terms of ownership of transportation vehicles is going to be a significant logistical and organizational challenge to mobilize these entities to participate in a national program. In Australia, we have appointed a number of large national carrier agencies, logistics firms, to undertake the distribution process. In fact, 3 large nationwide logistics firms who are vested with responsibility for managing the distribution process. You don't have that same luxury in Vietnam because, as you've rightly said, the majority of the transportation vehicles are privately owned and in the hands of small-scale operators. So this is going to require a very significant organizational challenge. It's going to require mobilization of these players on a voluntary basis, I expect, or maybe not, to second them into this process. So this is going to really be evidence of the investment that's going to be required in planning for a national vaccine rollout. You have the time at the moment to do this, but the needs are urgent in terms of meeting the logistical challenges. So I think you raised some very good points. Professor Gakara, is there anything you'd like to add?
Thanks a lot. Not significantly, but just maybe to emphasize what you just said about the way Australia approached this, i.e. appointing 3 large, very experienced logistics companies to run and manage this. But I think something else that is important in consideration of the Pfizer vaccine, which is the most challenging as we know, Pfizer itself, depending on what kind of contract you get into with them, have actually the capacity, or they present themselves as having the capacity to manage your distribution to a certain point. So what they've done, and some of you might know this, is they've developed their own cold chain facilities, the containers, from the large super freezers that are capable of keeping the vaccine for up to 6 months, to the slightly smaller ones that are capable of keeping the vaccine for 3 months, to the smaller briefcase size that are capable of keeping the vaccine for up to 10 days. So in a sense, and then in the Australian situation, what they've done is that they've got contracts with FedEx and Linfox. So FedEx and Linfox are their international distribution partners. So in a sense, if you wanted them, if you got into a contract for them to distribute from the origin to a particular point where you can take it forward, you have the capacity to do that. But I agree with you entirely. It's going to be a significant mobilization exercise, and there are a number of ways that you can do this. In my view, the best would be to designate a company or an agency under the management of the state that subcontracts the various small operators of the cold chain, so that the operation is effectively under one company or one agency. And I think that is important, because the last thing you want is to have, a situation where there is no central coordinated command position, because you don't want different messaging or going all over the place. And I think we've seen the same thing in Australia with the quarantine, in Victoria, particularly with the quarantine, where it was not effectively coordinated from the center. So I think it's going to be definitely manageable. And my understanding from my limited reading is that Vietnam already has the capacity, only that it needs consolidation and mobilization. Thank you.
Very good. Thank you very much, Professor. I see Miss Hue is with us, and it's lovely to see you here, Miss Hue, from the Vietnam Logistics Institute. And it's always wonderful to have you in our forum. I have a question, please.
Dạ vâng, em chào thầy, chào các anh chị ạ.
Yes, good morning, Darren. Good morning, everyone. I'm very happy to be here today at the webinar on a very timely topic. And it shows very strong interest from different parties and players. So based on the presentation by two speakers, I know more about experience and the realities from Australia in delivering or rolling out COVID-19 vaccine. I also like to share the experience from Vietnam based on the media reports. I know that some companies, for example, Vietnam Vaccine Company, that has been authorized by the Ministry of Health to import and distribute vaccine in the country. I also like to share with you that we have different target groups prioritized for vaccination, quite similar to that of Australia. We have different phases for vaccination for different target groups. So for phase 1, the frontline workers, health workers in Vietnam have already got vaccinated, but some of them experienced side effect and they couldn't respond quickly enough. So there were some incidents and some hospitals rolled out vaccination. So instead of vaccinating them at the normal vaccination room, now they do vaccination in the emergency room. So if anything happened, they can respond quickly. So I have a question for you. Given the vast terrain in Australia, how does logistics companies in Australia distribute from point A to point B? How did they do it? Given the long distance from point A to point B, are there any case studies or are there any lessons learned from emergency situation in Australia? And I also like to know whether you have any training materials to train health workers or logistics workers for this purpose. And if we need to have such training materials, then what could be the focus? So I'm wondering whether you can share with us, if any, the materials for training purposes.
Thank you very much, Ms. Ware. Really interesting questions. Look, I'll ask Professor Gakara to give his view on this, but I would say that, look, we're used to dealing with long distances in Australia. We're used to multimodal transportation options in terms of getting essentially foodstuffs mostly to remote locations. So we're used to this. This is something that's part of our established logistics distribution networks. So I think we have the track record in reaching remote locations. Of course, the challenge here is it's about temperature and time control. This is another layer of challenge that will feed into existing supply chains. On the question of training materials, it's a very good question to ask. And I think it's something that we will look further into, because you're right. We don't want to be reinventing the wheel here. We have the opportunity to share for those countries that have made the first move in training and upskilling of technical skills. There is the opportunity to share that material with our neighbours and our friends. So I think you ask a very good question about the training material. We can look into this and see what has been prepared to date. And if you're interested in receiving access to that material, I think we can see if we can source what has been used in the Australian experience to date. I'll ask Professor Gakara to respond to your questions as well.
Thank you very much, Ms. Wei. Very good questions. I think, Darren, you've addressed the question of the logistics quite well. So Australia has got a long history of managing crisis and movement of products and people into the remote areas, because that is something that happens all the time, because there are communities that live in these locations that obviously need to be supplied. But also there are companies and organizations within Australia. We've got Linfox, we've got Toll, we've got Shiva, Cube, TNT, and the rest of them that have got very large capacities to do this, from ships to large trucks and to smaller vehicles. So they've got the capacity to deliver this, or rather to manage this scale of distribution. The challenge actually was never really the movement of the distribution of and reaching these remote areas. The challenge, as Darren pointed out, was always going to be the management of the specific conditions that the different vaccines required. So in the Visa situation, it's how do you maintain the minus 70 degrees to the center of Australia, the red earth in Alice Springs and Coober PD and Kimberley and those places. So this is the area where we needed to harness the experience and the facilities. Now, obviously, the good news is that when you've got such large companies that have got a lot of experience in the transportation of frozen food and perishable agricultural products, it becomes much easier. Now, my view, again, from my limited understanding of the Vietnam situation, is that now I'm moving to the question of the skills in combination with the transportation. My view is that, my understanding is that most of the cold chain in Vietnam is used in food transportation and agricultural products, perishables, and all that. So the people that manage that already have the basic necessary skills for maintaining the temperatures and the condition of, let's say, for example, if it's fish and fruits and veg from point A to point B. So the way I would approach it is to think in terms of how do you sharpen the awareness. I think it's a matter of being aware about the delicate way that these products need to be maintained at all times. So they are not only temperature sensitive, they are also time sensitive. Okay? So look, the training task need not to be massively complicated. I think we should approach it as a way of sharpening the awareness of what needs to be done, as opposed to creating new skills. But as Darren said, there would be materials available that can always be drawn upon to do this.
Yeah.
Thanks.
Very good. Thank you, Professor. Yes, Ms. Ware, I think we'll come back to you on what we can find in the Australian context of materials that may have been specifically prepared to address, skills needs in the management of the vaccine rollout. So let me get back to you on that one. We have had some questions raised in our chat forum, which is great. I will pledge that if we're not able to answer all of the questions, that we will get back to you with answers, written answers after this session. So don't fear, we will respond to the questions that you're raising. But just one question that's come through from the chat function to raise now, and this is a question about standards, and a good question to ask. And I'll put this to Professor Gakara. And our respondent asks, I wonder if all carriers and related entities in cold chain applications are required to meet the IATA CEVA pharmacy standards. So that requires transportation of temperature controlled and time sensitive products, including vaccines, and they must, under that regime, meet pharmaceutical manufacturers' specifications. What's the answer to this, Professor? Are we conforming with these standards?
Of necessity, they'd have to. And I think that's that's an important part of the training that would have to be given. Because we are talking about transporters or transport operators who do not ordinarily transport medical supplies or delicate vaccines. They transport, common products of a perishable nature, food and fruit and veg. So of necessity, they'd have to adhere to the standards and the specifications that are presented by the pharmaceutical companies, because those are the specifications that are designed to ensure that the vaccines remain, maintain their efficacy to the end of the distribution. So the short answer to that is yes, although they ordinarily don't have to do this, I mean, this is not something that they're trained on and have to follow, but when they are subcontracted, so for example, when Linfox, and I've had a chance to speak to some of the people within Linfox that are involved, when they were contracted to manage the supply of the Pfizer vaccine and the AstraZeneca vaccine within Australia, they had to demonstrate the capacity and the skills and the technology to meet those requirements by the pharmaceutical company that supplies. Because otherwise then, if they cannot demonstrate this, then that means they don't have the capacity to do that, and therefore they wouldn't be subcontracted to do this or contracted to do this. Thanks.
Yes, very good. Thank you very much, Professor. What we might do now is we might move on to the next part of our program. Please keep sending any questions you may have, because we're happy to respond to them outside of this session, and we can provide those answers to you in the next couple of days if you have any particular questions. But what I'd like to do now is turn to what will be the last part of our presentation today, and to really talk about the capability of the LARC playing a central role in in managing the focal point function. Focal point function that is being identified by the World Health Organization as a necessity for managing the logistics of a national rollout. So what I'd like to suggest is we just talk about what opportunities might exist for the LARC in relation to this role. There is an opportunity for the LARC to take a central role, a leadership role in understanding, planning and coordinating the logistical requirements of a national COVID vaccination program. So we know there's an opportunity. The WHO have designated logistics focal points as being necessary in any national model. So we know there may be a call upon an agency, an entity to play that role. We have an opportunity for the LARC to promote the critical role of the logistics sector in any national rollout. This is right in your space. So we have that opportunity in front of us. It's an opportunity to learn best practice as well. You're not doing it alone. Countries all over the world are grappling with these same challenges. There'll be a lot of opportunities to learn both from the Australian experience, and as Professor Gakara rightly pointed out, our rollout has not been entirely successful. So that is able to then generate lots of learnings, lots of experience that countries like Vietnam can adopt and use to avoid repeating some of the challenges that we've faced. We'd like to also say that the LARC has the opportunity and the capability of developing a pathway forward for a nationally coordinated logistics program. The other thing I would say is leadership, around leadership. And I guess it's really time now to start to test whether the LARC feels, members of the LARC feel that the LARC is capable and ready to play an effective national leadership role. I mean, this is an opportunity. And if there is a sense that the LARC is capable of playing a leadership role as a focal point for logistics, then we need to think about what it is that the LARC can offer. What does the LARC need to play this role effectively that it doesn't have presently? So there may be some capacity, some technical needs that can be addressed to elevate the LARC's capability to play this role effectively. We want to also think about how the LARC can position itself to advocate for this central role. So what does the LARC need to do? Who does it need to present its credentials to? Who does it need to advocate to secure consideration of taking on this role? And we also need to be cognizant of whatever gaps may exist presently in terms of logistics infrastructure, in terms of human resource capacity, in terms of capability to lead in this central role. So I'd like to open up the floor now to ask you, as members of the LARC, as stakeholders, as observers, whether you believe the LARC is in a position to play this leadership role. And if so, we can then start to look at a communication piece which could be used to position the LARC to play this central focal point coordination role. So can I now open up the forum for anyone who would like to make a statement in relation to the LARC and its capability? Is there a sense amongst our audience that the LARC is ready and able to take on a focal point for logistics leadership roles? Or are we still seeking to build the capability and capacity of the LARC. Please, I invite anyone now to make comment in relation to those questions. Please put your hand up if you have a question or a comment to make, and we'll ask you to address the group. Any comments? Anyone wish to make any statement about the LARC's capability in this regards?
Mình muốn nghe mọi người ý phát biểu trước thì mình phát biểu sau. Minh có phát biểu gì?
I really want to hear from the audience. So, Ning? Or Vinh?
Cảm ơn
Well, thank you very much, Darren. Well, this question is quite interesting, and for the first time, we have the webinar on this topic. It's quite new to Vietnam, but it may not be new to you. In Australia, and Shamadev representative said that they have experience, they have equipment in cold storage transport. So we have here today members of LARC from different organizations. So I really want to hear from you any suggestions based on what Professor Victor Jekara has presented. For example, do we need to have courses on awareness raising on this matter? Because once we become aware of this, and we can better understand the role and the importance of LARC. So this is my personal opinion. Thank you. From Ming at Oxford Skill.
Yeah, look, very good points, Miss Ming. I think we need to recognise that the LARC has within its membership some of the largest enterprises in the logistics sector in Vietnam. We have Gemadap, we have Transimex, we have Saigon Newport, we have Toll, and we have Linfox. These are some of the largest nationally based distribution organisations in the country. So, you know, one would think that within the membership of the LARC, we have very good coverage of some of the largest players in the logistics sector in Vietnam. Would anyone like to make any comments in reflection of Ms. Ming's statement or Mr. Ning's statement?
Darren, is it okay if I make a comment?
Please go ahead, Victor.
Yeah. Look, this is just my contribution. I've worked with the Australian industry standards for a very long time, from the time that they used to be the Transport and Logistics Industry Skills Council. We've done a lot of good research, I think, which has gone into influencing the skills development and generally competency building within the transport and logistics industry in Australia. And I think that the Australian industry standards plays a very significant role and a very critical role in that sense. And my view is based on the fact that a sector is as good and as strong as the skills of its workforce, because that's what creates a sector. Now the LISC, sorry, the LISC has even a greater opportunity, I think, than the AISC, because of the ways in which they're constructed, has a great opportunity to play a very significant role in this sector. Because of the kind of membership that Darren has just highlighted there, the kind of organizations that comprise the organization, gives it, one, access to the industry. Therefore, you can directly influence what is going on in the industry in terms of workforce planning, skills development, and the policies that go with that. But also, it gives you the capacity to very easily and strongly have a conversation with government about what needs to be done at the policy level to ensure a strong skill base within the sector. So in contribution to the question that Darren asked, I think you have a very, very strong position to influence industry, to influence policy, and be the key organization within the sector that determines the strength of that sector. That's my strong view.
Thank you very much, Professor Yakara. Mr. Ning, would you like to make some points about that?
Tôi có một số những ý kiến.
Well, I also like to make a few points from an enterprise perspective, which is a member of the LISC. Well, in the roadmap of the LISC by 2024, we haven't got any idea about the involvement in this supply chain. This is unprecedented, and it comes from the reality. So as practitioners in the logistics industry, we see that it's critical to make our voice heard, and that's why we have this webinar. Of course, there are some challenges to LIRC, because LIRC is designed to promote the industry-led model for workforce training and development. What is advantageous to us, but not other associations could have, and that is we have very strong linkage with VCCI and also with Australia and other line ministries in Hanoi. So we have strong support from the public sector, and we could become a focal point in this process. And in terms of operations, we can provide training to logistics workforce, and we are in the best position to provide training. We work with TVET institutions, with logistics enterprises. We also have the framework for occupational standards. So when it comes to storage, transport, and distribution of COVID-19 vaccines, I think LIC could be in the best position to do so. And second, based on the presentation by Professor Victor Jakara, in Australia you have Linfox and another company to be the primary contractor, and then they can work with others. And in Vietnam, we also have Linfox in LIRC. We can leverage that experience. We can ask Linfox and other companies in Vietnam, big companies, who can sit down together to have the synergy. If we do not have one single company that is big enough to do the task, so we can make a recommendation to the government and also to CDC to give the task to a group of companies. Linfox may not, speak directly to Deputy Prime Minister Vũ Đức Đam. We can speak through VCCI, which is a very strong supporter of LIRC. So through the webinar today, we can produce a report and we can say that this is what we can do, and this is what we have done. And if the COVID-19 committee wants us to do this and that, and then we are more than happy to do it. And if we say that LIC could act as the focal point, then it could be challenging in terms of from legal perspective and also capacity. So this is the point that I'd like to suggest for further discussion. And I also want to hear from VCCI. I think all of these could be reflected in the report or in the minutes so that we could further think about. Thank you. That's all. Thank you.
Yeah, look, these are excellent points that you make, Mr. Ning. I was hoping that today we could produce a communique, a statement of intent, let's say, on behalf of the LARC. I think everything you just said is effectively that statement. I think you're right to highlight that the LARC has very strong linkages with the business community and with government. That is clearly an advantage of the LARC. You also have linkages to international organisations and international experience through your partnership with us and other organisations. This is also very important for drawing on lessons learned from other jurisdictions who are further down the track with the vaccine rollout. You have the opportunity to learn those lessons and minimise the mistakes that others have made. So I think that's the second key value that the LARC has. You talk also about being in a good position to identify training needs, because the LARC has the membership of vocational training colleges. We are in a very good position to expedite human resource capacity needs very quickly. So I think those three things are the essential value of the LARC. I think you've articulated them, defined them very well. And I'd like to suggest we put that in our communique that we draft as a statement of intent for the LARC to be considered in playing a central role in a national rollout. I think there's also something else. We have within the LARC membership some very high capabilities in communication. And dissemination of information. Of course, we have, and I see Miss Yao with us today from the Vietnam Shipping Gazette. You know, they are excellent in developing good targeted messaging, communication messaging. So we have within our team the right mix really to play a coordinated role as a central agency of focal point for logistics. But you're right, you have highlighted a couple of things which are going to be constraints. Firstly, the LARC does not have any legal status. That is accepted and understood, but that should not prevent the LARC as a pilot model from seeking to elevate its status in the national response and present its credentials for consideration. So I think we should still persist with this ambition to position the LARC, notwithstanding that you're right, that there are legal constraints on its status presently. But look, I think everything you've said is very much on point for the type of communique that we would like to see developed out of this forum. So I think you've raised some excellent points. Is there anyone else that would like to add any comments? Mr. Viet?
Yes, ladies and gentlemen, I also like to share my point of view from a Tibet institution perspective in terms of workforce development in response to the vaccine deployment or rollout. I think in the years to come or in the future, VCCI is expected to release a forecast on logistics occupations. So I hope that LCIC can update the skills needed for the delivery or deployment of COVID-19 vaccine so that TVET colleges can update their curriculum and deliver the training to meet the demand. And also Ask for Skills or LIRC may organize courses and transfer the materials to improve the skills or to provide the skills needed. And for TVET institutions, we will update our curriculum based on the skills forecast, and we try to align the curriculum to the skills we need. And also to meet the requirements of the industry. And finally, we hope to have a network to share information with respect to skills or the sharing of materials or documents, so that we can have the synergy and collective wisdom. I think Ask for Skills and BCCI have done a very good job of linking us together, bringing different players together in the logistics workforce development. So this is what I'd like to share with you from a perspective of the TVET institution. Thank you.
Thank you very much, Mr. Viet. It's very useful to have the perspective from the training institutions. We have really, I think, presented with a very strong focus on the challenges for logistics enterprises in this rollout, but we have to remember that sitting behind all of this is a training and skills development need. And you've quite rightly highlighted that space still needs to be developed specifically for the needs of a vaccination rollout. And you're right, the colleges have proven to be very versatile, very adaptive so far. And I think by sitting in the LIRC platform, we're able to have that common dialogue with industry. And I think this will prove, this exercise, if there is an ability for the LIRC to become a player in the national vaccine rollout, we will see the benefit of the LIRC as a platform for dialogue between the vocational education sector and the business sector, because we're able to move quickly. We'll be able to respond and adapt to the needs of training and skills development quickly because we have the platform. So I think that's where I see the advantage of the LIRC being very much in line with what you've said and the points that Mr. Ning raised in his comments. So if there's not any more comments at this point, what I'd like to do before we conclude, we've sort of run out of time to finish this, but I'd like to start it. And what I'd like to propose is that we develop a communique or a statement of intent based on our webinar today. And I'd like to briefly show you some suggested text and some suggested structure for that communique. What I would like to suggest is, in the few minutes we have remaining, I'll just take you through the elements of the communique, but I would like to propose that based on the comments that we have collected today, particularly in the last parts of our discussion and some of the statements that were made by Mr. Ning earlier, we, I think, have enough material here to draft a communique, which we would then distribute to you, to the LIRC leadership for review and comment and adaptation, to become the central statement of intent on behalf of our webinar today. So if that's agreeable, let me just take you through some of the things that I think we need to consider in this communique. So we see the opportunity. We've talked about the opportunity that exists here. We talked about maybe using this communique to position the LIRC for a leadership role. It can become an advocacy piece. We can distribute this to government. We can seek to position the LIRC for consideration in a leadership role. And this will be a chance to legitimate the LIRC as an effective representative body in line with the comments that Mr. Viet and Mr. Ning have made about the capability that already exists within the LIRC. So that's something we can do. I guess in terms of how we would seek to get the information that we need, the components of a communique could form a statement of intent. What is it that we want to achieve? It could form a statement of capability. And Mr. Ning's comments just recently outlined exactly what that capability is. It's linkages to enterprises and the vocational sector. It's good relationships with government. It's the ability to mobilise a skills development response. All those things are evident in the LARC now. So we have that capability. What is it that we want to achieve? Well, we'd like to see the LARC positioned as one of, or the primary focal point for logistics, organisation of the logistics response in the COVID vaccine rollout. That's our ambition. And I guess we need to consider who needs to listen to this proposal. Clearly, there are arms of government we would seek to position this to, but there's also parts of the sector itself, maybe using the Vietnam Logistics Association, for example, to disseminate some of these messages. And of course, we now have the LARC website established, and we are using social media platforms as well. So we have the mechanisms to distribute this messaging. This is just a suggested text that could be considered for our, I guess, statement of intent. It's a draft, and given that we've largely run out of time now, what I would suggest is I would like to draft, based on our discussion today, a communique that I would then seek to circulate to the LARC leadership for consideration. Given all the comments you provided, the thoughts that you provided, we've been able to capture that. We have recorded this webinar today, and we can reflect on this again. I would suggest that we lead in the drafting of a communique based on the comments we've received, and then we seek the endorsement of the LARC for that communique. So this is a suggested statement of intent. I'd be very happy to receive any of your comments by email or any other means. You know that I can understand some Vietnamese, so please feel free to communicate with me in Vietnamese if you wish to feed any of your thoughts into this. But I think our essential statement of intent is that we pledge to offer the support of the LARC to undertake a leadership role in the distribution of COVID vaccines. We see the LARC as being uniquely placed for the very reasons that Mr. Ning articulated earlier, as the key platform for industry engagement in the sector. Not just industry engagement, but also engagement of the vocational sector. We need to also include that. So this is the statement of intent. We will flesh this out with some more statements of capability, and that will then be used to form the basis of our communique. Are people generally happy with that approach? Would anyone like to make any comments at this point? Is anyone seeking to add anything specific to what we might be able to draft? If you have any views, please let's use these last few minutes to hear them. So I again invite anyone to make comment on what I've outlined here. Mr. Ning, please.
Well, I very much agree to what Darren has proposed. That means you will draft the communique based on what we got from the webinar today. Actually, this is the very first webinar that we organized. So I think the communique should provide details so that we not only send the message to the government, but also to logistics enterprises, so that we not only have a proposal made to the government, but also to provide information to the industry. So I hope that Darren keep this in mind. You can extend the scope, reflecting what we had from the webinar. You can also reflect the experience from Australia. So all could be included in the communique so that we can share not only with the government, but also with the industry, with the logistic and the enterprises. Thank you.
Yeah, very good comments, very good suggestion. I think that's a good way of broadening our messaging to not just be focused on a government audience, but we do also need to feed back into the sector itself to raise awareness about this possibility, this role that could be played, and to start, I guess, the mobilization of those disparate and disaggregated capabilities that exist within the sector, particularly around transportation. So I think that's a very good point. We do have a dual audience here that we need to be communicating with. Any other comments that anyone would like to make? If there are no other comments, can I suggest that we conclude our webinar now as we originally scheduled? But just to wrap up, look, I think we've really just started to scratch the surface of the issues which are relevant to this particular topic. There is a lot more that we could talk about and share with you from the Australian experience. Of course, the Australian experience continues to evolve, and we are continually making reforms and modifications to the rollout, and that's an important thing for us to share with you over the coming months as well, how the Australian response has adapted to some of the challenges that Professor Gakara was able to identify and talk about in his presentation. I should say that if there is a desire amongst our constituency to get into more detail around some of these opportunities and some of the logistical organisational needs to play this central role, we would be happy to develop further training and webinar materials and conduct further sessions based on your needs. So if you see an opportunity to continue this dialogue, continue these learnings, and continue the sharing of our experiences, we would be very happy to develop further webinars based on specific technical issues that you think need to be addressed. We've really just given you a very broad overview through this webinar, but there are lots of specific detail that we could get into, and we would be very happy to invite Professor Gakara and or other experts who can add to this conversation in a future webinar or series of webinars. And I'll leave that for you to consider and respond to in your own time. But for the moment, let me express my sincere thanks to you all for your participation today. I think we sought to invite about 20 participants, but somehow we've managed to end up with a lot more. So I hope that's an indication of the level of interest that we were able to generate in this webinar. It has been really good to see the degree of engagement, and it's good to see the diversity of participants in this program. So yeah, I would very much like to thank you all for your very kind contributions to our webinar today. It's wonderful to see so many of you again, and good to see so many new faces here as well. I see Miss Ming has her hand up, so I will ask her to make some comments. But for my part, let me conclude now and wish you all the very best. And you will be hearing from me again very soon, because I have a draft communique that I intend to share with you very, very soon. So thank you so much. I'll now hand over to Miss Ming to make some comments.
Yeah, I just want to say that can people turn on the camera? So Darren, can you stop sharing your screen and group photo?
Tôi đeo là chụp ảnh.
Không, đeo trên ảnh nhé.
We will take a group photo.
Yeah.
Nào cười nào, smile. Ở bên ngoài bên kia.
Okay, say cheese.
Hương ơi, cả Hương cũng chụp đi được. Chụp mấy cái xem xong chọn cái nào đẹp nhất đấy. Quyết ơi, Quyết sao lại Quyết cứ bật cam đi. Dạ, không lên à? Ok.
Header. Very good. Okay. Look, thank you so much again. Thanks for your participation. I suspect this isn't the end of our conversations on this topic. So I sincerely hope we can convene again and assist you with the detail that you need to position your enterprises and your training institutions to be ready to make this challenge, of the national vaccination rollout. So thank you all. Thanks for your participation. Been wonderful to see you all again and to meet some newcomers to our forum. And I will be in touch very soon with a draft communique for you to consider. So I wish you all the best. Good luck to you all. And hẹn gặp lại.
Chào mọi người.
Chào bạn.